Hip and groin pain, causes and treatment. The groin is the area between the hips, the inner thighs, and the lower abdomen. Causes of pain in the hip and groin can be musculoskeletal or internal. Musculoskeletal issues begin in the bones, joints, or muscles. Those that cause hip and groin pain are often sports injuries. Some internal health problems that cause this pain include a hernia, endometriosis, or a cystic lesion. In this video, learn about the internal and musculoskeletal causes of groin and hip pain and their treatments. Musculoskeletal causes. Groin pain can be a symptom of a musculoskeletal condition at the front of the hip. According to research from 2018, these conditions may include hip osteoarthritis. This occurs when the cartilage in the hip joint wears away over time. The American Academy of Orthopedic Surgeons explain, gradually the bones begin to rip together. Symptoms of hip osteoarthritis include pain that travels from the hip to the groin, where it can feel intense and persistent. Pain at the front of the hip. Pain at the back of the hip. A clicking or grinding sensation in the hip joint. Pain that flares during activity, rainy weather, or both. A decreased range of motion in the hip, possibly causing a limp. Treatment. Treatment and management techniques include physical therapy, maintaining a moderate weight, low impact exercise, corticosteroid injections, surgery. Femoroacetibular impingement. Femoroacetibular impingement causes additional bone to form along the bones of the hip joint. As a result, the bones may rub together when the person moves. As research from 2016 explains, femoroacetibular impingement pain begins around the hip joint, then radiates to the groin. When a person with femoroacetibular impingement twists, turns, or squats, they may experience sharp, stabbing pain. At other times, the issue may cause dull aching. Other symptoms include a persistent feeling of stiffness in the hip and groin. Groin pain that comes and goes. Limping. Treatment. When symptoms flare, it can help to take anti-inflammatory medication such as ibuprofen and modify physical activities. If the pain persists, contact a doctor. Treatment approaches include physical therapy and a procedure called arthroscopy, in which a surgeon uses a tiny camera to view the inside of the hip and repair any damage. Acetibular labral tear. This is a tear in the labrum, a layer of cartilage along the rim of the hip joint socket. The resulting pain can extend to the groin. Specific symptoms include pain that develops gradually, pain that is worse at night, dull pain that can become sharp when the person walks, sits for long periods, or runs, front hip or groin pain that can radiate to the knee, a sensation of clicking, locking, or catching in the hip. Treatment. Conservative approaches include rest, non-steroidal anti-inflammatory drugs, pain medication, activity modification. Physical therapy, corticosteroid injections. Surgical options can include labral debridement. This involves removing the labrum. Labral repair. This involves securing the labrum in its regular position. Labral reconstruction. This involves partially or fully removing the labrum and replacing it with a graft. Osteonecrosis of the femoral head. This issue, known as ONFH, causes the hip bone to deteriorate and collapse due to a lack of blood to the area. The cartilage that covers the hip bones also deteriorates, resulting in arthritis. Hip pain is typically the first symptom, and it may accompany a throbbing pain or dull ache in the buttocks and groin. As the condition progresses, it may be difficult to put weight on the hip and any movement may be painful. This progression can take several months to a year, and getting an early diagnosis leads to a better outlook. Treatment options include anticoagulant medication, hyperbaric oxygen therapy, surgery. Internal causes. Internal causes of hip and groin pain may stem from underlying conditions or growths in other regions of the body. The issue may be an inguinal hernia. This involves part of the bowel pushing through a gap in the abdominal wall, typically just above the groin. A hernia can cause pain in the groin that can extend to the hip joint. Treatment. A person with an inguinal hernia needs surgery. The surgeon will either push the protruding area of the bowel back inside the abdomen or remove it and close the gap in the abdominal wall. Endometriosis. Endometriosis causes tissue similar to the uterine lining to form in areas other than the uterus. When this tissue grows on the round ligaments of the pelvis which support the uterus, it can cause pain that radiates to the groin, hips, legs and buttocks. The severity of the pain can change and may intensify according to the menstrual cycle. Treatment. The main treatment of endometriosis is hormone therapy, which works best when symptoms are not severe. A person can also take pain medications such as ibuprofen. If symptoms are severe, surgery may be an option. Cystic lesion. A cyst can develop around the hip joint. It may be a ganglion or synovial cyst, both of which are sacs that contain gelatinous fluid. As the cyst grows, it can put pressure on the surrounding nerves, arteries and veins, causing pain that radiates to the hip and groin. Also, ovarian cysts, which form on the ovaries, can cause pain that radiates to the groin and hip. Each of these types of cyst can accompany other health issues, affecting the choice of treatment. The best approach might involve rest, non-steroidal anti-inflammatory drugs or acetaminophen. The application of heat, physical therapy, needle aspiration, which involves extracting fluid from the cyst, possibly for testing. Surgery. Home treatment. The right approach at home depends on the cause of the pain, so it is best to check with a healthcare provider. While waiting for guidance, a person might try applying hot or cold compresses, resting, taking non-steroidal anti-inflammatory drugs. When to see a doctor. Anyone with hip and groin pain should see a doctor, especially if they are also experiencing any of the additional symptoms described above the video. Pain often extends from the hip to the groin and vice versa because the structures are so close together. In some cases, the pain begins in a different area and radiates to the groin and hip. The pain may result from damage to the bones, joints or muscles, or from a health condition affecting an organ such as the intestines or ovaries. Getting an accurate early diagnosis is the best way to help improve the outcome.